Okay. Balance safety with need for control and independence. And that's an ethical issue, isn't it? Really, we really always got to talk to the patient. I don't care how demented the patient is, we always talk to the patient. And I think that's a show of human dignity. And then I'll often ask them for permission to talk to the loved one. Do you mind if I talk to your wife? They mightn't have the ability to comprehend that, but I think that's a bit of human courtesy that we should always maintain. This is a human being, an individual in front of you, always maintain that human decorum. Because they're used to that human. They read the nonverbal communication. They read if I'm talking to the spouse and ignoring them. So I might talk to him or talk to her, and she may butt in, but I'm going to be looking at him. Because that's important. People read communication skills. That's burned into our brains for years and years. Task: too complicated, too rushed, unfamiliar, initiated at inappropriate time, maybe lack of awareness, patience. If I can say one thing to anybody who cares for somebody with dementia, you've got to have very, very good sense of patience. You have to know when to walk out of the situation when you're becoming impatient. You may have to leave the circumstance and come back in 5 or 10 minutes when you collect yourself. How many times have I heard spouses with severe dementia tell me how they have to take time out sometimes just to get a moment to themselves? Right? It's really hard work as a caregiver. It's just as hard on the caregiver as it is with the person with dementia. In many ways it's harder, because the person with dementia with the advanced stages tends to lose insight. So they're unaware of the depth of the problem, whereas the caregiver is always aware of the depth of the problem. But you have to support both the caregiver and the person with dementia in order to achieve a harmonious state. And guys, I tell you, this is not easy work. This is hard work. The people in this room who are suffering from this illness know how hard this work is. This is not easy. Body language, I've said that a dozen times. Physical positioning, non-confrontational, eye level. Don't talk down. Don't point. Don't use a loud voice or aggressive voice. Talk soft. When you're looking at the person, look in their eyes. When you're talking to them, when you go over. If I walk around and I know this fellow here, how are you doing today? I haven't seen you since last week. You're looking great. So you make a human contact. You use eye contact and you settle the person down. Tone of your voice. The mood or emotions that you're exhibiting that day. You've got to put it in the closet. If you're having a bad day at home, somehow or another, you've got to put that in the closet. And you've got to say, I'm coming in here, it's going to be the best day ever. Start every morning that way. Being a professional nurse in this day and age got to be one of the hardest jobs out there. I'm in a ward, I'm only there for a few minutes. I look at the nurses around me who are doing this stuff day and night, and I must say I admire them. Right? And somehow or another our system got to recognize that these people need time to vent. This is a stressful job. If you're at home looking after somebody who's stressful, you need to have that space. It's very important that families pull together, that you work out some schedules so you can give the person who's the primary caregiver a break. Because in the advanced stages, they need breaks. They'll need it.
Do they still work 12-hour shifts?
Yes, they do. And I agree with you. I think in dementia care, 8 hours shouldn't be any longer than 8 hours. But the problem is with the way the nursing systems are today, we've shot ourselves in the foot. This 12-hour system, I think, is not. Yeah, but I say, you know, that's a system decision that was made for quality of life issues and a whole lot. But I agree with you. I think 12 hours working out a dementia unit will stress the most caring of anybody. We really got to start looking at those systems in detail. And as we get this problem more and more comes to light, I think people will have to start looking at, are we doing this the best way we can possibly do it? I don't have a better solution. I really don't. We have enough trouble now trying to staff our floors with the 12-hour systems. And if we move to an 8-hour system, I don't think we're going to be able to staff the floors we got now. That's the situation we're in. So on the ground, institutional, we're at about the limit of tolerability at the moment. I can't see us thinning down the systems anymore. We've got to get better building designs. We've got to upregulate the training of our nursing homes, our personal care homes in dementia care. It's a massive educational challenge we have ahead of us. Massive. Information overload, approach, moods, and or emotions. Tone of voice. Look for triggers in 4 areas: the person, the environment, the task, and the approach. Remove triggers if possible, limit exposure to triggers. I talked about the person. Know yourself, know how you behave. Know your environment. You don't want to have a noisy environment that has a lot of traffic going on. The task. You want to know what the specific issue is that needs to be addressed. And what is the best approach we can use to address that issue. So if it's a bathing issue, what works for this person? If it's a feeding issue, what works for this person? If it's a social issue, what works for this person? And design the care plan around that person's needs and what the family know works. The family will tell you. They have figured this out. Usually the spouse has all the answers. And if they don't have, they have many of the answers. So one of the things you almost need to do with if you're working in long-term care, you need to have a couple of hours sitting down with the spouse just to figure out the nuances of the care. Because if they just go in and they drop the loved one in the institution and leave, there's a whole lot of information that that institution needs right now that that person just walked out the door with. Okay? So that's important. For the LPNs in the office, in the audience, I can't overemphasize that enough. Okay? Limit exposure to triggers. There's always a trigger to a behavior. And we got to knock out triggers that are negative and feed the triggers that are positive. Okay? Yeah, good. I think I'm just about there. Describe the behavior. What happened just before the antecedent? I talked about that. What happened just after the behavior? Possible solutions. I've sort of reiterated that over and over again. 5 R's: reassess, reaccess, reconsider, restrict, rechannel, redirect. Another way of looking at behavior. Okay? I'm not. The Alzheimer Society seems to be on all these numbers and letters. Remember the 7 A's last week and the 5 R's? That throws me off. But I'm just simple. ABC. Antecedent, behavior, consequence. Simple. Keep it simple, stupid. That's how I work. KISS principle, right? And approach to care. Try to view things from the person's perspective. Always try to put yourself in that demented person's place. That's a hard thing to do, but try it. Look for and build on the person's strengths. Stay calm. Practice good communication skills. Not take anything personally. When that person is cursing and swearing on you all day long, you got to realize that's frontal disinhibition. That's not the person. That's the disease process. How it's affected their central computer and how they're responding to the environment. It's not you. So somehow or another, you got to take that burden, that cloak off you, and throw it in the garbage at the end of the shift and walk out. And when you're a spouse at home, somehow or another, you got to get out of that environment. And you got to get somebody else in there to take. When that weight is so burdensome that you can no longer cope, and you're getting physically anxious and upset, because that's going to be fed into the loved one, and they're going to give you a negative response back, and that's going to make everything worse. You'll get a cascading effect. Not to argue or reason, to keep your sense of humor. I think that's really important. And we have lots of fun. In our day, in the Miller Center, we have lots of fun. And I think, you sit back, and sometimes the person will say the most profound thing to you. You look back. I was on rounds the other day, and the nurse is walking around with me, and she says, "How are you today, Mr. So-and-so?" He said, he said, I don't know who you are, but I know your father right there. And she's about 10 years older than me, the nurse was, so I thought maybe. So, you do have your moments, eh? And these are good things we've got to build on, right? So, remember your sense of humor. That'll keep you through a bad storm. And here we are again. Who, what, where, when, why, how. Questions answered. Any questions from the group?